Diabetes is reversible. Don't feel diabetes is irreversible. Sure, I tell you, you can say diabetes is a disease. You can say diabetes is not a disease. How you know? You all know diabetes, sugar is a lifestyle disease. So you have a question and answer in that. So it's a lifestyle disease. So some lifestyle only given you that. If you change the lifestyle into a positive approach, then it's there is no diabetes. So it's a lifestyle disease. Changing the lifestyle will make you come out of diabetes. So how to change the lifestyle? Then you may ask, what wrong I am doing? Okay, nothing wrong you are doing. The environment is now very stressful environment, very bad environment. Of course, we are not able to believe anyone. If we are believing, we may lose our assets, we may lose our liveliness. So because it's very dangerous world, we are all controlling our emotions, our love, and also our naturally we have something we want to help others. We born like that, but we are controlling that, and we are not bothered about anything, not bothered about anyone, because there is danger. But what to do? If we are going in that way, we are getting diabetes, we are getting heart attack, we are getting stress hormone, cortisol, we are getting so many diseases, stroke, hemiparesis, hemiplegia, kidneys damage, kidney failure, like this, all diseases we are getting. So we cannot avoid being happy or being with love. Okay, love and happiness both are together only. Without love no happiness, without happiness no love, like that it is. So love life, happy life we must have. So this is the most important factor, 70% reason for diabetes mellitus. Then the next factors are our food. We must have fruits and vegetables in everyday life. Minimum 3 fruits, maximum 7 fruits we should have without cooking. Okay, fruits and vegetables, raw fruits and vegetables will make you to become non-diabetic for sure. And third one is exercise. Exercise means non-aerobics, non-weight bearing exercises will help you to reverse diabetes. Okay, actually diabetes, if you don't want for your entire life, your mental health is important, love and happiness is important, and you must avoid stress, depression, anxiety, illusion, hallucination, and negative thinking, inferiority complex. All this you have to avoid, and you have to motivate self love, self respect, self motivation, positive thinking, and life with a lot of self appreciation. Okay, gratitude journaling should be there. All these you should have to avoid. But if you have diabetes, suddenly you want to come out of that within 3 to 6 months, changing the lifestyle cannot work, because already you accumulated lot of fat, you accumulated like a lot of secretion from the pancreas. All this happened. So exercise will help you. Non-aerobics, non-weight bearing exercise. Non-aerobics, non-weight bearing means, first I will tell you what is aerobics and weight bearing. If you are bearing your weight on your leg, that is called weight bearing. If you are running, walking, increasing the cardiac output, that is called aerobics. For example, walking, running, jogging, dance, aerobics, or Zumba, or cycling, or even swimming. These all called aerobics. And standing, walking, running, all these called weight bearing. So these exercises are increasing the cortisol most of the time, hiking the cortisol. So it is not very useful for reversal of diabetes. It is also giving lot of complications like knee pain, neck pain, back pain, sciatica, varicose vein, lot of complications it's creating. So what, and they're not able to do consistently, and increasing the cortisol. So non-aerobics, non-weight bearing exercises are lying exercise, or sitting exercise from the head to toes. doing exercise for all the muscles like frontalis, corrugator, superciliaris, orbicularis, from this, and cervical muscles, sternocleidomastoid muscle, trapezius, biceps, triceps, brachioradialis, pectoral muscles, and paraspinal muscles, cervical muscles, lumbosacral muscles, abdominal muscles, pelvic floor muscles, gluteal muscles, quadriceps, hamstring, calf, all these muscles. Soleus muscle is very important in this, which is in the calf. Foot exercises are must in this. So in this way we can really come out of diabetes. Okay, now I will explain you how can diabetes can be reversal. First I will tell you biology of diabetes mellitus type 2, particularly insulin dependent or non-insulin dependent. Actually biology is pancreas is secreting insulin. Insulin is a hormone. Insulin is the hormone which is a transportation, like taking our glucose into the cells and converting into muscles and all, like it is metabolism, it is burning. Okay, because if the burning happens nicely, no diabetes. Diabetes how comes? When in the blood the glucose what we are eating converting into glucose, sugar, that is increased only. Diabetes we are called as diabetic patient. How it is increasing? Because this insulin not taking this glucose into the cells. Why not taking? Because of the stress, depression, anxiety, because of the sedentary lifestyle, or because of the too much exercise, too much workload, not sleeping well, all these reason, because of no love and no happiness. So what to do in this? If you want love, if you are with love and happiness, it will really take it into that. If you are eating fruits and vegetables, all the nutrition if you have, it will take it into that. And if you are doing non-aerobics, non-weight bearing exercise, it will work nicely. Non-aerobics, non-weight bearing exercise, how it works, from the head to toes, gently 7 times contract and relax. This kind of exercise I am teaching you. Whenever you want, you can call me to know that. So what happens? These exercises are even without insulin help taking our glucose into cells. So what happens? It is why diabetes formed? Because glucose is more in the blood. So glucose is more. What happens? Our pancreas secreting more insulin to send glucose into the cells, but unfortunately cells are forming insulin resistance. It's not allowing insulin inside to take glucose, and because transport it is not allowing our glucose not going into cells. So what happens? Because it is secreting more and more, once it gets tired and it is not even secreting insulin, which is pancreas. So it's called that insulin dependent. Then only insulin injection you are taking. So in this way it is getting worse. But when you doing exercise, all the muscles are activated and it is improving the circulation. So it is hungry for glucose. So it is taking the glucose even without the help of insulin. So in that way glucose is going in. So pancreas is getting relaxed. It is secreting less insulin, and slowly in the period of time glucose resistance will become glucose sensitivity. In that way it is taking the glucose into that, and you are getting reversal. This happens mostly within 3 to 6 months. I have so many testimonials for that. In this way you can become a diabetic reversal. In the same time you can change your lifestyle by a happy love life and eating fruits and vegetables. All these together will make you diabetic free patient. If you want these classes, you can call me anytime. You can talk to me and you can really you can have this. I will teach you. There are 2 hours take home exercise which is very easy and consistently you can do. I will teach you for 15 days minimum, daily 1 hour. It will be very helpful. And follow me for health tips. Call me for physiotherapy consultation. Physiotherapists call me for nice opportunities. This is Prakash Physiotherapist.